yet of that leading to increased transmission on our side of the border, but we watch that and we worry. Of course, the continued gatherings in the streets. The other a cause for concern, generally, see mask wearing. We see attempts at social distancing, but we remain concerned, and I think we'll start seeing, if that led to an increase, we will start seeing that really any day now. And I think it is likely that there will be some transmission. It's almost a certainty that there was some transmission at those large gatherings. What we don't know is it tens of people or hundreds of cases that arise from people who weren't able to avoid the physical proximity as they participated in those. And then finally, just the ongoing making sure Coloradans remain vigilant, continue the mask wearing, the efforts of social distancing. Those are incredibly important. We've made so much progress. We need to maintain that progress. We don't want to backslide like some other states have, and that is directly the outcome of your choices, your decisions to be safe, to wear masks when you're in public, to be 6 feet from others where possible, public groups to 10 or less. Your decisions to do those things will prevent our state from backsliding and make sure we can move forward, leading the way in economic opening and being able to have more freedom and choice and being able to just get some of our lives back. I also want to start, there's actually new evidence, important evidence on studies on mask wearing. A new study by Britain's Cambridge and Greenwich University showed that social distancing alone, it's hard to have that alone stop the resurgence of coronavirus, but pairing that with large-scale mask wearing, the rate of infection is dramatically reduced. It is a powerful and easy tool that we have, a powerful and easy decision that you can make to save lives, to get our economy going, and that life that you save might even be your own, might be a loved one and might be your own. So let's be smart, Colorado, and let's do our part. That's why we recently launched a public service announcement around mask wearing. And, we're going to just, of course, keep repeating this because it's a very easy thing that we can do to reduce the economic damage of the virus, to reopen as quickly as possible, to save lives, perhaps including your own. Wearing masks in public is what we need to do. And masks are really the passport to the Colorado we love. It's the ticket to more prosperous future, more jobs, more sustainable society. Until we have a vaccine or cure, we are doing our best to make sure that Coloradans are armed with the information you need to make informed choices, to protect yourself, to protect others. So far, you're making the right choices. We just need to keep that up. We also have seen a lot of exciting new developments around telecommuting. Today we want to we're announcing a new program that really highlights companies that are doing the right thing and getting creative with telecommuting, reducing in-person interactions. And that has several benefits, telecommuting. First and foremost, we reduce the likelihood of transmission of COVID-19. That's why we're having this discussion. Many companies don't lose any productivity with a certain percentage of people commuting. The state, by the way, our state, over 30,000 employees, we have a majority of our folks telecommuting, and yet we're still able to offer all of our critical functions. Many companies are doing that too. There's also other benefits to telecommuting. There's less traffic, right? Less air pollution. We save time. We save energy. There's more worker productivity because people aren't stuck in traffic. Reduction of wear and tear on roads, which can save taxpayer money. And then there's additional health benefits besides less transmission of COVID-19. Higher likelihood of exercise with flexible schedules, lower blood pressure. So what we're doing around, and this change that's coming about because of COVID-19 has a lot of other positive aspects to it. And I know that many employers are doing the right thing, and they're not losing any productivity, and they're allowing telecommuting. And we think that's a great idea, and that's why we're launching the Can Do Colorado Community Challenge to encourage companies and as well as local government entities to keep the momentum going on telecommuting. We're championing telecommuting wherever possible, and it's a partnership between many of our state agencies, all doing our part to make sure that we can continue these practices across our state. We're going to provide more information to the media, to the public on candocolorado.org about the opportunities for business and local government to get involved. We really want to highlight all of the great work that companies are doing to encourage telecommuting. The state stands alongside you. We ourselves are doing that as well. I also have want to talk about mental health for a moment. As you know, last year I directed the Colorado Department of Human Resources to spearhead Colorado's behavioral health task force. We're now collecting data, and one of the things that's important is we want to hear from more young people, ages 12 to 26, about mental health experiences, and we're soliciting input in this new online survey, coloradoyouthsurvey.com, coloradoyouthsurvey.com. It will be open until June 22nd. You can access it by visiting. We want to learn a lot more to tailor a response around the mental health needs of younger Coloradans and all Coloradans. Now, some of you might have noticed the mask that I wore when I came in today. It is promoting Census 2020. It's happening now, and it's incredibly important we all get counted. The census is about a lot more than just a number. It's about how much resources we get from the federal government over the next decade, and our voice, our political voice. So it's incredibly important. You should have filled out the census form that arrived at your home with a unique number. If you haven't, please do. If you've lost it, you can still complete the census. Just go to census.gov. Incredibly important for our own benefit, for your benefit. Let's make sure that we are counted. And just a quick note, the census may call you if they have questions, but again, be smart. They are never going to ask you about bank information or money or passwords or anything like that. That is not the real census. If that is the person asking you that, it is a scam. The census will just ask you the same questions that are on your form. They are anonymized, just number of people in your household, basic questions like that. If they start asking personal stuff about bank accounts, you can report them to your local police department. Before I get to questions, and today will mostly be about hearing your questions, we'll have more announcements next week in new areas, making sure that everything is reopened safely. But for this week, I want to finish by sharing a personal story about the importance of safety precautions like wearing your mask. And while many of us have stayed healthy during this crisis, some of our fellow Coloradans have been hit very hard, and including many of our state employees. And one of them, Mike Clark, gave me permission to share this story with you. Mike's a civil engineer with the Colorado Department of Transportation. He came down with COVID, like many Coloradans, in mid-March. He spent 9 days in bed. He got weaker and sicker. He had to go to urgent care. And next thing he remembers, waking up 2 weeks later at the ICU at St. Anthony's. He woke up to nurses in white plastic space helmets, a ventilator down his lungs, no way to talk, constant thirst that couldn't be satisfied with no way to swallow. 2 or 3 days after waking up, they were able to remove the ventilator, which just that process of that, Mike said it felt like having his toenails pulled through his throat. But at least then he could whisper, he could beg for ice cubes. And after being in bed so long, he lost 3% of his muscle mass per day. He was barely able to walk after that experience. And this is a direct quote from Mike. "If there's anything that should prompt you to wear a mask at work, it is the thought of lying in bed in a hospital atop a bedpan." So if the risk of death doesn't scare you, the risk of a very difficult and painful experience in a hospital hopefully should. The good news is that many people like Mike who walk into the hospital will walk out, but I want to be clear that it is extremely unpleasant and painful. And of course, some won't walk out. Mike had to learn to walk again with the help of a walker. He's now finally able to eat solid foods and walk with a cane. And there's tens of thousands of COVID-19 cases in Colorado, and behind each case is a person. And while I hesitate to call Mike lucky, certainly some people haven't been as lucky as him, I do want to thank Mike for being willing to share his story, just so we can remember what's at stake. Mike, thanks for your work for the Colorado Department of Transportation, for the state. Thank you for being willing to share your story, and please have a full recovery soon. And, as Mike told me on the phone today when I talked to him, he said, look, if sharing my story can lead to just a few people making the smart choice to wear a mask, a few people being cautious, save a few lives, it's worth me putting myself out there. So let's be smart, wear the mask, stay 6 feet from others, be safe on our work sites. These are common sense steps that we can take to protect ourselves, our loved ones, our community. And with that, I'm happy to take some questions. Stefan?
Governor, can you talk to the issue of what seems to be a frenzy of late in Hollywood, to toy companies, to just you name it, military bases being renamed. What is your take on this frenzy of pulling Gone with the Wind? Senator Elizabeth Warren, I think today, introduced legislation in the Senate to rename some military bases. Are you aware of that? What do you think? And is there a thought of here in Colorado renaming anything because of the current climate?
Well, I'm largely focused on the COVID-19 health crisis. I'm aware in some sense of some of these national discussions. I would just say that we want to learn from history. We don't want to wash out history or pretend like history didn't happen. So we need to learn from history. There's powerful movies about the Holocaust, Schindler's List, many others. There's powerful movies about slavery in this country. And they can be painful to watch. It can be painful to watch what, artistic portrayals of what actually happened to people in our country, across the world. And we learn from them and we see them. And so the answer is certainly not to sweep that under the rug and pretend it didn't happen. It's to confront it head on, to talk about the complex and difficult legacy of racism in this country born out of the original sin of slavery, and how our nation can come to terms within a nation where everybody is created equal under God, and how we can manifest that in deed and in action, not just in words in our Constitution and Declaration of Independence. Telephone?
Hello, Governor. This is Vinny Del Chudas at Bloomberg News in Denver. Regarding the virus, what has Colorado done differently from other states that have reopened and seen a surge in hospitalizations and COVID cases? And how can a state protect its borders? Thank you, sir.
Yeah, so, I worry about a lot of things. I worry about Arizona and Utah. I worry about Coloradans maintaining their vigilance with mask and social distancing, and I worry about the large number of people in the streets. Those are my four biggest worries right now. We have been a leader in reopening safely. We were one of the earliest states for people to be able to be in stores and get their hair cut and all those things. But we're doing it in a way where we're heeding the advice of scientists that we do it in a better way. I mean, if you got your hair cut recently, I had mine cut. I wore a mask, and the person doing it wore a mask. There is is anything perfectly safe? No. If you want to be perfectly safe, you stay at home. But we have made normal everyday activities, economic and social activities, as safe as one could reasonably expect. I mean, if you want your kid to be on team sports, you can in the month of June. Is it zero risk? No. It never was zero risk, right? I mean, your kid could get a concussion or break a leg, and even before COVID, they could contract something else. But yes, this is an added risk, a small added risk for kids, but obviously greater for members of their family and grandparents. And people have the right to make those choices, to take those risks. We just want to make sure they're done in as safe a way as possible. Gyms are another example. Gyms, and I haven't been to one yet, haven't had time. They're not like they were last January, but they're open and you can work out and you can exercise, and it's being done in a reasonably safe way. So I hope that other states are being smart about it, because we are a nation. People can travel between Arizona and Utah and Colorado in particular. Obviously, they can come here from New York or other states too, but we're more concerned with those in our physical proximity. So we're trying to do this in a sustainable way. I don't think it does any good to do something that is so careless that it leads to such a large spike, that it leads to enormous economic setbacks for your economy again, right? So can't guarantee we're going to get everything right. We are doing our best to be able to prevent the virus from reaching a level where it overwhelms our healthcare system and our hospitals, realizing that it is still with us and is likely to be with us until there's a cure or vaccine. From the room?
Governor, the business community yesterday came out against a lot of the Democratic legislation aimed at helping the state handle the coronavirus crisis. They called on Democrats to slow down the legislative session. They also called on you to veto a number of bills, including the tax bill that I asked you about last week. I'm curious if you're hearing those concerns, if you share the same concerns that Democrats are maybe going too far in the legislature and will ultimately hurt the state's economic recovery.
Well, there's many bills there, and obviously we're supportive of many of those efforts. Many of them backed by the business community. Some are not. I don't yet see a route for how that tax bill could become law. There would obviously need to be a negotiation with us. There hasn't been in the last few days. We remain open to the conversation, the negotiation, but I don't currently see a pathway for that bill into law. There are other bills that I see a strong pathway for. Certainly, paid sick leave is a powerful tool in fighting this pandemic. Doesn't mean everybody in the business community likes it, but while the WHO has made problematic statements that they walk back, I think before and after that we all knew that the larger part of transmission is from symptomatic folks. There is, of course, also transmission from pre-symptomatic, asymptomatic. It's a factor, and the WHO, didn't mean to say something to the contrary, and then they backed off of that. But clearly, symptomatic is a big driver, and when it comes down to it, a Coloradoan experiencing symptoms shouldn't, under duress, have to go to work because they can't make their rent if they don't. We all need them to stay home. They need paid sick leave. And frankly, that's a good idea for other diseases too. I mean, why have people spreading the flu and assuming we get through the COVID piece, anything else? So I think that's common sense, solid. Most Coloradans already have paid sick leave. Doesn't affect them. Just affects the folks that don't. Those are mostly hourly workers. So, number of ideas out there. We're looking forward to working with the legislature to make sure that we have an agenda that's good for business, good for workers, good for health. Good for business, good for workers, good for health. Telephone?
Yes, hi, Governor Mary Ann Goodland with Colorado Politics. Just by luck, I'm going to ask a follow-up question to the one Jesse just asked. What is it that you want to see in this tax fairness bill, which, by the way, just passed on a vote of 39 to 25?
Well, on any fiscal policy, obviously, they need to involve and gain the support of the governor's office. And there were discussions a few days ago about what that would entail. And there have not been any negotiations in the last few days. Our door is open. We're happy to talk to sponsors and others. We're happy to find a way to make it a pro-business package that would be good for jobs and good for business. And we look forward to seeing if there's a path to get there. But at this point, I'm not terribly optimistic. Mm-hmm.
Yeah, the portion of new cases of coronavirus that are coming from nursing homes is down. In late April, it had kind of surged up to about a third of the new cases. At the same time, the state has ramped up some inspections for nursing homes. What have you learned specifically from those inspections and from the deficiencies that have been found, because there were many deficiencies found? And should the public expect that those deficiencies will diminish, that things are going to be improved? I know that there are some new kind of plans for nursing homes rolling out.
So I think the nursing homes are taking this with the seriousness that it deserves. They're doing that, of course, partially out of our efforts and diligence, partially out of demand from their own residents and families. Part of that is the practices around isolating positive cases, around making sure that people are able to be safe. The other part is the testing that we are doing, asymptomatic, pre-symptomatic, and and this is where I think World Health Organization got into some problems. People who are pre-symptomatic, which means they are, in fact, asymptomatic currently, they don't know they have it, transmit the virus. Several days before they have symptoms. They have the viral load. They might develop symptoms 3-4 days later. And they have a period where that's one of the nefarious things about this virus. They are contagious. The test will pick it up. They have the viral count. And many of them will develop symptoms. And then the other part of that is not all. There are absolutely asymptomatic cases. There's a debate around how contagious they are. There are incidents where that likely was transmitted from somebody who was asymptomatic. It seems that the body of evidence shows that they might be a lower transmission risk than pre-symptomatic or symptomatic, but nevertheless, if somebody's asymptomatic, and they can absolutely, and they have, spread it at nursing homes. So the testing of the workers to keep pre-symptomatic and asymptomatic individuals out has been absolutely critical in preventing the introduction. And then the safety protocols in the nursing home have led to outbreaks of 1 or 2 instead of 30 or 40 or 50. And we have to make sure we temper that with the social and emotional needs of our older Coloradans to see their loved ones. And that's why we are going to be shortly rolling out the details on what we announced last week, which was the Lifeline Pass program, a way that people can get tested if they haven't been exposed or negative, can have more visitation with their loved ones that are in congregate care settings in as safe a way as possible. Telephone? What's that? Let me do a couple, telephone, and then we'll do 2 more from the room. Telephone?
Hi, Governor. It's Jessica Seaman with the Post. Your executive order on evictions and foreclosures expires this week. If the legislator is unable to pass a bill to codify the order, what steps are you prepared to take to address housing insecurity during the pandemic and recession?
Well, we know that this is a very tough time for hardworking Coloradans. We have taken some of the strongest steps in the country, and our office is working with the General Assembly to continue work on that important issue, including rental aid package, $10 to $20 million that would provide targeted assistance, making sure that landlords were kept whole, and that tenants would be able to, in the most need, would be able to stay in their housing. From the room?
Can I get your thoughts, Governor, on CNC Coffee and Kitchen is going to open this weekend? You had made them, a part of a press conference a few weeks ago, and you were not happy. Thoughts on them opening this weekend?
I'm thrilled. I'm thrilled for every Colorado business. I'm glad that they've resolved their health hazard and are reopening. It's absolutely terrific. The more Colorado businesses that safely reopen, the better. And I think it's great news that we should all welcome.
Your fears about people not adhering to the coronavirus guidelines, whether it's mask wearing or keeping groups apart. There's a group of 30 people in the park right behind us who aren't wearing masks and are gathered together. I'm curious how you plan on getting the word out more. I know you started the public education campaign, but I think people are becoming more lax, and I'm wondering how you plan to ensure folks don't let down their guard.
Yeah, and that worries me. If there's 30 people that are together there, not if there's 30 people spread out in the park, that's fine. But a group is worrisome if they're not social distancing. There's a way to have the bigger groups, and that's why we have, for instance, youth and adult sports. Because when you have something organized like that, it could be 20, 25 people, but you know who they are. So and there will be, when there's one who has it, you know who to warn so they can get tested. You have the tracking and tracing ability. We will have that in schools. We have that at workplaces. Where we don't have that are just large informal gatherings, where it can go from 1 to 40 people before anybody knows what happened. And then those 40 people are contagious without knowing it. Asymptomatic, pre-symptomatic, some developing symptoms, some being hospitalized. So we would worry about that. I think Coloradans are smart. By and large, they are doing their best to stay safe. Doesn't mean every Coloradan is in every circumstance, but staying 6 feet apart from others, wearing a mask, whether it's a rule in your city or not, right? In some cities they fine you for not wearing masks, but it's not about it's not about trying to get around it, right? It's about trying to stay safe. Whether you're in an area where it's legal or not, just be smart, wear a mask around others, and of course try to be 6 feet away where you can. This is the way we will sustain the progress that we have made against the virus in Colorado and be able to continue on this positive trend of getting more and more normalcy. We have a Denver Zoo, Cheyenne Mountain Zoo, Pueblo Zoo. They're open, right? It's great. More and more businesses are opening. It's really exciting. We really want to keep on that track, and people need to make smart decisions, and then they can make their own decisions about what level of risk they're comfortable with and whether they want to go to a zoo or a park or get their hair cut. But let's be smart about it. Let's be smart about it. Jesus?
Hello, Governor. Jesús Carraquel de Noticias Univisión en español. Gobernador, si la curva de contagios ha aumentado en estados vecinos como Utah y Arizona, ¿qué está haciendo usted para evitar que estos casos lleguen a Colorado?
Sí. Estoy muy preocupado que hay más personas en Arizona, en Utah, cada día, quien tienen coronavirus. Me preocupa porque estos estados son cerca de nuestro estado y mucha gente viaja entre los dos estados cada día. Hay un poco más de distancia entre el Denver área y los otros estados, pero otras partes de Colorado son muy cerca de ciudades y de centros de población en Utah y Arizona, y me preocupa mucho por este peligro.
Recent mobility data collected by these third-party companies.
See it well,
Sure.
but I'll just
I
trust
can-
you on that.
Yeah,
What is
I
it
can-
showing?
I can describe what this shows. Basically, this last weekend, Coloradans looked a lot like they do during a heavy snowstorm like we see back in February. It's down to about that level, from a peak in mid-late April of distancing. Now certainly these people aren't at nightclubs or at bars and restaurants up against dozens of people at a time, but we are seeing people are increasing their mobility. So how does this compare and fit in with, the recommendations from Dr. Salmon's team and what we've been talking about in terms of social reduction percentages of 55 to 65%?
So the mobility is an indicator, but that is not determinative. We look at a number of different mobility estimates, I'm not sure which one you're showing me, but they're all showing a similar thing. Yes, Coloradans are more mobile. What they don't show is what they're doing, right? And we are focused this month on safer at home and in the great outdoors, the great vast outdoors. So, Coloradans camping, hiking. In fact, maybe it's a way to empty, instead of the 30 people together in that municipal park, wouldn't it be great if they're on broader county open space and further apart from one another? So it's no surprise people are driving a little bit more. People are going to areas of the state that have more land and less people, and that can be safe. So the data doesn't show us exactly what they're doing there and whether they're being safe about it. But I'm not discouraged by the fact that they're traveling more. It really depends on what they're doing. Our state park system remained open through the entire COVID crisis, in part because we wanted to give people more room to recreate than they might have in their local municipal park, further away from one another. Campsites are now all reopened. It's up to private ones if they want to reopen, but they can, and the state ones have been open for some time. Safer at home and safer in the vast great outdoors. And we say vast great outdoors because we don't just mean, crowded together outdoors. So, if your municipal park has too many people, go to some county open space, go to a state park, go to our federal lands, lots of room in Colorado. Comanche National Grasslands, southeast Colorado, wide open, right? Federal land, walk around, enjoy it, beautiful. Lots of great space in Colorado for people to enjoy our June weather with their family in our vast great outdoors.
Governor Corey Jones with Colorado Public Radio. A question about this month's primary elections. I know most of the state votes by mail and ballots went out this week. But what steps is the state contemplating or taking to prevent spread at voting sites and among election judges, elections division workers who will be opening and examining ballots, starting very soon?
So, first of all, I'm grateful that we don't have a lot of the concerns that other states do that traditionally have crowded polling places and lots of action on election day. We've had mail-in ballots for well over a decade. They've been fairly universal since I think 2014 or 12. But even before that, most Coloradans or many Coloradans voted that way. So that is good. But yes, in terms of people processing, counting, the county clerks and others are doing their best to do that in a safe way. Mask wearing at the workplace where people interact with others, making sure the ballots are not contaminated by having waited long enough before they're opened and read. It's being done I'm confident that our county clerks and under the guidance of our Secretary of State are administering our elections in a way that is reasonably safe for all those who work in elections and for all those who volunteer to help in elections. And of course for voters who generally drop their ballots off or send them in. Voters can of course vote in person, and there's safety protocols around how that can be done in a reasonably safe way for people who lost their mail ballot or just feel like voting in person. And I encourage all Coloradans to vote. Everybody should be getting their ballots around now. I haven't gotten mine yet, but yesterday, today, tomorrow, next week, unaffiliated, Republican, Democratic voters are all getting their primary ballots. If you're unaffiliated, you can participate in the Republican or Democratic primary. Encourage you to do so. There may be one that's competitive in your area or one that's not, so you can make that choice. If you're a Republican primary voter, you can participate in the Republican primary. If you're a Democratic primary voter, you can participate in the Democratic primary. But I encourage everybody to have their voice heard, to cast your vote. These decisions matter, especially because many districts in our state are heavily Republican or heavily Democrat. There's obviously competition in some in November, hopefully most, but for many of them, you are picking the candidate with a very high likelihood of representing all of the voters in November. So, and even for the competitive ones, you're picking the one that will be one of the two contenders for November. So please participate, please vote, and participate in the census at census2020.gov. Thank you.